Hi, my name is Nicole Ahdoot, and I am doing my therapy presentation on functional communication training. Functional communication training was created for autistic children who are experiencing social and communication challenges that required direct intervention. It was found that strategies that were positive and within the child's typical environment they increased the student's skills in that area. Functional communication is a positive behavior support intervention that is designed to reduce problem behaviors by replacing them with meaningful or functional communication. And that functional communication can be gestural or verbal. So in other words, rather than the students having a tantrum or displaying other disruptive behaviors when frustrated and not getting their needs met, they communicated their needs in a more socially acceptable way through the use of words, through the use of alternative communication systems, which could have been an alternative augmentative device, or PECS, the Picture Exchange Communication System, or even gestures, such as pointing. Could be simple as that. Functional communication training it covers children who have nonverbal, mixed, and verbal skills. It covers children from pre-kindergarten to high school. So the pre-kindergarten and elementary school levels, functional communication training there have been studies done on functional communication training within those levels, so the pre-K and the elementary levels. There haven't been any studies that have been done within the middle and high school levels, but speech-language pathologists who have used functional communication training within the middle school and high school levels have given positive feedback on using that functional communication training. So it still can be used within the middle and high school areas. It covers the classic and high-functioning cognitive levels, and it addresses the pre-academic, cognitive, academic, adaptive behavior, daily living, behavior, communication, speech, social, and emotional areas within the child. There are 4 steps to functional communication training. The first step is to identify why the problem behavior is occurring. You do this by interviewing the student, interviewing the teachers, interviewing the parents, interviewing all the students in the classroom if they're at that age level where they can be interviewed and you know they're not lying about something. You can even interview any other interventionists that are working with the child, and that information can be valuable to your findings, considering that those people are around the child most of the time and in their natural environments and in many different environments. You also observe the student on several occasions and in a variety of settings, and collection of data regarding the frequency and specific circumstances under which the behavior occurs is very invaluable to your information collecting. At this point, after you've collected all of your information, you have to form a hypothesis, and you form this hypothesis about the cause or the function of the problem behavior. So now you've collected all of your data, you are thinking, well, why is the child presenting with this problem behavior, and what is he trying to communicate? And that is your hypothesis. That's all in step 1. Step 2 is to match the function of the behavior to the message of the alternative communication that will be taught. So, for example, if the function of the student's tantrum, the student is having a tantrum towards the end of an activity or after a certain amount of time doing an activity, if the function of that tantrum is determined to be escape avoidance, so the child needs a break, or whether it be a bathroom break, playing with friends, or just a switch in activity, you offer the student an effective way to signal the need for a break. So the child is crying, the child is being frustrated and having a tantrum because he needs a break. You've hypothesized that that's why. So now what you have to do is you have to find an alternative communication for that child to use that is more socially acceptable and easier for you, because a tantrum is not something that we want a child to be having, whether it be in the classroom or at home. So For example, if your child is nonverbal, then you would give him a gesture to use instead of the tantrum he's having. So you would say, all done is the gesture. Or if he can read and he's still nonverbal, you can have a sign that he lifts up for break, or even just pointing to a sign for break. So those are some different types of functional communications that you can use to replace the problem behavior, which is the tantrum. So that's all in step 2. Step 3 is you're prompting the use of the communication and reinforcing the desired behavior with the desired outcome. So it's very important that once the child has actually used the functional communication that you have taught him, the all done, or the pointing to the break sign, or the lifting up the break sign, you have to reinforce that behavior with the desired outcome. So as soon as he uses that behavior you want him to be using, that gesture, you take him out for his break, you take him to the bathroom, or you take him to play with his friends, or you switch the activity. So you need to give him that outcome that he's looking for from using your desired behavior, and therefore you're reinforcing that desired behavior with the desired outcome. The 4th step is very, very critical to functional communication training. It's basically that you ignore the problem behavior and prompt the use of the appropriate communication. So if our child is still having his tantrums and he's not using that functional communication that you've taught him, then what you need to do is you need to ignore it. You need to completely ignore the tantrum, continue with the activity or whatever it is you're doing that he needs a break from, and until he uses that communication strategy that you have taught him, that gesture or that sign or whatever it is, do not give him what he wants, because then you are reinforcing the negative behavior, the problem behavior, and it's teaching him that by having this tantrum, he'll get what he wants. So those are the 4 steps of functional communication training. Basically, in a nutshell, it's obviously more extensive than that, but that's the basics of functional communication training. If you go online, you can just Google functional communication training, and there's a lot of very valuable resources that you can actually use within using functional communication training with your child. So I found here an implementation checklist for functional communication training, and basically what's on it is the steps of functional communication training and its subcomponents. So here you can see it says identifying the interfering behavior, which is the first step of functional communication training, as I've said before. And underneath it says, identify an interfering behavior or a subtle communicative form to be the interfering behavior. So this is the first step of functional communication training. What you do on this checklist is you give it a score of 0 to 2, 2 being that you implemented the step of functional communication training. So if it was identifying the interfering behavior, you would put 2 if you implemented that identification, 1 if you partially implemented it, 0 if you did not implement it at all, and not applicable, or NA for not applicable. And you do that all the way through for every step of functional communication training. It's all in this little handy checklist. And it doesn't just say the steps, it also says the subcomponents of the steps that you need to be using, so you can nicely divide that all up. So that's a good resource to use. Also, there is a functional communication training data collection sheet that you can find on Google. And this is a nice thing to have while you're going through the 2nd, 3rd, and 4th steps of functional communication training. Basically, it has the date. So it has the date that you're recording this information on, has the activity or setting, has the antecedent, which is basically what happens right before the interfering behavior or the replacement behavior. It has whether it was the interfering behavior or the replacement behavior. And then there's a little scoring thing right here, which is basically, if you see these little letters, it's to do with the prompting that you're using. So the I stands for that it was independent, that you didn't have to use any prompting for the child to use that functional communication. The P is for physical prompt, to use a physical prompt. The G is for a gestural prompt, and the V is for a verbal prompt. So after you put down the prompt that you wanted, there is the consequence. So what happened directly after the interfering behavior or the replacement behavior, and notes. So anything extra that you have, you can put in there. And this is a very, very good resource to have to organize all of your data while you're implementing the functional communication training. There are many other resources online, and honestly, just Googling it is very, very helpful to finding all of these resources. So functional communication training, it does meet the evidence-based practice criteria with 5 single-subject design studies that demonstrate its effectiveness for promoting appropriate behavior and communication skills for children at the preschool and elementary school levels. So as I said before, these studies were done at the preschool and elementary school levels. There have not been any studies done at the high school and middle school levels, but SLPs who have used functional communication training within those levels have said good things about it. So it still can be implemented there, even though it's not technically evidence-based within those grade levels. So functional communication training targets the skills that help children and youth with autism, but also children without autism who have that problem behavior that you want to replace with that functional communication, or that more socially acceptable way of communicating. It helps them to effectively communicate with others in a variety of situations and settings. Even though functional communication has not, the research did not demonstrate the use of functional communication training in community settings, it might be ideal for the teaching to occur in community settings if interfering behaviors commonly occur in those settings. So that's basically functional communication training in a nutshell. I have provided the handout online. It basically says everything that I said within this video. And also there's a few examples of functional communication training so you can see it in action. So I've applied it to different situations with different children, and you can read about those. And if you have any questions, you can always contact me through Moodle. If not, I hope you enjoyed.